Welcome to another interesting episode. Today we're going to be talking about why hospitals reject pregnant women. Haven't you wondered? I've wondered many times. I see it in the news. A pregnant woman goes to the hospital, usually when they are in labor, and the hospital says, no, go elsewhere. I feel it's not right in a way. But I know it can't just be a blanket answer. So we want to discuss why. Right? And we want you to also contribute to this discussion. Ask your questions. Are there things that bothered you about this particular issue? So what do you think?
Yeah. Ideally, a pregnancy is a journey of 9 months. Okay. And you expect that a pregnancy should be planned.
Yeah.
So if it's a journey that is planned, you expect that some arrangements would have been made, or vis-a-vis the person attending antenatal care, at a particular place. The reason why antenatal care is important is because during that pregnancy, you get to find out the risk and complications that can happen, whether it's by virtue of the age of the mother, the previous pregnancy, the issue and all that. They look at everything and then they are able to plan the delivery even in the process. So antenatal helps you to know a lot about that pregnancy and plan for it, and even envisage complications that can arise and prevent it or mitigate it. So there are many reasons why a hospital can reject a patient. One, I don't know you, and I do not want to take responsibility for you or what I do not know.
Okay.
That's one reason. I do not have the resources to manage what I'm saying at hand. That may be another reason. Okay. Whether resources in terms of material resources or the expertise to manage the complication you're bringing.
All right.
Number three.
Before you go forward, okay, let's examine those two.
All right.
That you talked about. So I don't know you. Why do you need to know a pregnant woman? She's in labor.
It's very important. Pregnancy is a journey of 9 months. And you expect that ideally, in an ideal situation, it's a journey that should be planned for. There are things that predates before the pregnancy that can affect this current pregnancy. Yeah. There are things about the health of the mother that can affect this pregnancy. There are things about the previous birth experience.
Okay. Exactly, that's true.
Exactly, that can affect this current pregnancy. It's not just about seeing someone on the spot and taking a decision. Those information are very important in taking a decision now.
You said something else about resources.
Yeah.
What do you mean by resources?
Resources in terms of material resources or human resources to care for a patient. So there's a complication that has arisen in that pregnancy or during labor. But at that point in time, the hospital does not have a personnel that can perform a C-section, a cesarean section at that time. The hospital does not have anesthesia. The hospital does not have blood
available.
All
right, so fine.
Plus, let me have this. The hospital does not have neonatal care.
Yeah, it brings me to a story that was trending online a few weeks ago.
Right.
A man took his wife to the hospital, and he made a video of how he was in front of a particular hospital, and the hospital said they were rejecting his wife, and he was begging. Actually, I think you watched the video. I didn't watch the video, but I learned the video trended online. He was begging the hospital to at least accept the woman. But I think the excuse he said the hospital gave was that he did not have 500,000 to deposit. And that was why they sent his wife away. And then he took the wife to a different hospital, and the wife died on the way. That's the summary. So mother and baby died.
Lost.
That's part of the reasons why I felt, we need to discuss this issue.
Right.
That was the man's side of the story.
Yeah.
So I then checked and I saw the side of the doctor. The doctor then says, well, the patient it was a complicated case, and he was not able to manage that case in his hospital. As simple as that. So it wasn't about the money. He just said we would not be able to manage you in this hospital. Go to another hospital,
A higher facility.
a higher facility.
He actually said go to a general hospital. Unfortunately, I think the place, the hospital where the woman was referred to was quite a distance from where they were.
Then to end that, I then saw another interview with the man.
Okay.
Where he then opened up a little bit more about what actually happened. Apparently, you talked about antenatal care now. She had been receiving antenatal care in quotes from they say the person is a nurse. I don't know what the qualifications of the person are.
Auxiliary nurses.
Yes.
Well, I'm not saying that the person is an auxiliary, but generally in Nigeria, you can't differentiate when they call someone a nurse. It might be an auxiliary nurse. Yes. If they call someone a midwife, it may be a faith-based midwife. Exactly. So you don't know.
You need to be sure.
You need to be sure.
So how they were doing this antenatal is that they would go to the woman's house. How can you as a pregnant woman be going to someone's house for antenatal care? And of course, the husband said it was because of money. Right? Because they were not. Well, interestingly,
maybe a traditional birth attendant.
Maybe traditional birth attendant. Yeah. Okay. So they were the ones that did the antenatal. The wife was fine in the morning of this incident. And then I think they were going to induce the woman because she was already post-date.
Wow.
So it was at that nurse's place. I don't know if she has a little facility, maybe it's a maternity, probably, where they induced the labor and then there were complications
from induction.
Yes, and then they referred the patient to a hospital based on that.
First of all, I remember usually when we want to induce our patients, one of the things we tell them is that this induction is a point of no return. We cannot uninduce you. If we start induction, we must end it with the delivery of the baby. Either you deliver yourself via vaginal birth or it ends in cesarean section. Induction should take place at a facility where cesarean section can be performed, where the complications of induction or any complication that can arise from induction can be done.
Can be managed.
Can be managed.
Okay. So, putting this together now, if a woman is not, I know nothing. It's just like I want to play a football match and I don't know anything about my opponent. I don't have a response.
And unfortunately, such places, you don't get a referral. They don't write referral.
They don't say be going.
They don't write referral. They just say be going.
Even if they write referrals, it might be one funny referral.
They won't write everything they've done. What was used to induce that woman?
When was the induction?
When was the induction done?
Then
the timing, all those things. And then the doctor must have looked at it that he had accepted or not accepted that woman. It might still have ended in fatality or mortality.
Yeah.
At the end of the day, people don't remember the source of the problem.
Yeah.
It's where the patient dies or the mortality or the morbidity takes place that they remember. And then maybe the story won't be that you didn't accept the patient. Why did the patient die in your hospital?
Yeah.
That's what the point will be. That's what will be said in the media and everything. The backstory won't be said.
Yeah. Now, so I think in a way we've established that one of the most important reasons, if not the most important reason, why it seems like some hospitals reject pregnant women is simply because they are unbooked and they don't know anything about the patients. If you are a booked patient, I will probably feel that, no, I need to manage you because I'm committed to you. But if you are just coming from outside, I can decide that, no, I'm not going to take on this case.
There's no law that says that a doctor should commit to the care of a particular patient.
Yes. We have choices.
We have choices as medical practitioners. The proviso is that so far you are referring to that patient to another medical professional who can handle that particular case. Yeah. The best you can give to that patient is emergency services that can keep the life of such patients.
Like I always say, let's not be in a hurry to jump on trends of people just going on social media to blame hospitals. you need to know that it's people, human beings that run those hospitals, even though you may have things against them, but sometimes you need to find out why they're actually doing those things that they do.
So what are the lessons we should pick out from this, for our people to pick out from this?
One, the period of antenatal care is so important. So important. Don't take it for granted. It's probably even more important than the period of delivery itself.
And during this antenatal, one of the principles during is for risk stratification. Yeah. You are able to categorize pregnant women. Of course, a pregnancy without complication is a diagnosis of retrospect. Yeah. Until delivery, you can't really say that a pregnancy went uneventful. But, somehow there are things on ground that you can use. Oh, this pregnancy can become complicated. And it's one of the reasons why antenatal care is there. And once you recognize certain risks, please don't sit, and this to health facilities, whatever cadre of healthcare facility, don't sit on such patients. Refer them in time to the place where they can receive proper care.
Yeah. Next, I want to talk about these maternity homes and places that are not really hospitals.
Okay.
That do antenatal clinics, maybe these traditional birth attendants. How do we manage this? Because I know now the government is trying to incorporate
because
the system.
The specialists are few, and they can't cover the whole population, so they empower such people. And most pregnancies would go uneventful.
You can actually deliver at home.
At home, some people deliver in the car, and nothing happens. But the few ones that complications arise is usually very, very bad. So most ones will go to TBAs and all of those ones without anything happening. But we owe those women responsibility to identify. I think they should be empowered to identify such risks and complications early on.
Complications are
so that
recognize them.
And in fact, they should have a referral center linked to them.
Yeah.
So that once such, please, we have this woman we're sending. In fact, they are the ones calling that referral center. Yeah. I have this complication. I'm sending that patient now.
Yeah, the other thing I want to advise people is this: if you are able to afford a particular standard of care, and you then go below that standard. I mean, if now we are saying they are traditional birth attendants because of the population.
Yes.
But remember that there are a number of people, by virtue of their education, by virtue of their income, that are able to afford a particular level of care.
Yes.
So you cannot tell me that you earn well, you have a car, you have a house, and then you are going to do your antenatal with a traditional birth attendant. It doesn't
tally.
Because it means that you have not gone to a place where you receive more standard care. You just decided to go elsewhere where they may mismanage you, and then at the end of it, you'll be speaking big English. They will now start wondering, this person speaks very good English.
Yeah, I've actually met such people. They speak good English. They are well educated, and they go to these places.
Yes.
But some go out of ignorance. They don't know. Yes. But once you find out that, please leave.
Let's leave those other ones, those places for those that cannot afford it. People cannot afford it. In fact, there are some people that cannot afford to go anywhere. They give birth in their houses.
Yeah. Well,
if somebody says, I'm not saying people should give birth in their houses.
No, that's not
what I'm saying. Is that if you see somebody that says, I've not even eaten today, so where do you expect me to find money to go for antenatal? Yes, I'm going to be able to reason and say, well, you have a point. You've not eaten today, so why would I expect you to go for antenatal? Right? To understand, there won't be any blames. But if you can afford to go on vacation and then you feel that you are going to go to a TB or a maternity center to deliver, and then there will be complications, because I've seen videos like that. There will be complications with the baby. The baby is not able to breathe, and then they send
develops deformities,
develops asphyxia. Then they will send the baby to a hospital, and then they expect the hospital to perform magic.
Exactly.
And then they are not, when the video comes out, they are not going to blame the place where they were referred from. They will start blaming the hospital and saying those hospitals, they don't even know what they are doing. So let's stop all those kind of So basically what we have said is the reason why hospitals reject pregnant women is because they don't have enough information about those women
or resources
to manage those patients. So if you don't want to be rejected by any hospital, make sure you are booked in standard facilities. Sometimes people book in two places. They may book in a government hospital, they may book in another standard private hospital. You have no business booking with people who are not specialists when you have the specialists around you.
Exactly.
If you are in the bush and there's no specialist here, you can argue it. But please, let's take note of that. Is why hospitals will reject you. Okay. May we not be rejected.
If you're a TB or maternity center, please identify risks in time and send those women in time. Also have a referral link, a qualified health facility where you can quickly call when you are stuck.
You know that we might have left one or two things out that bother you. So why not put
them in the content so that we can address them? Why don't you ask your
questions? We can answer those questions.
Of course.
We are not saying we have all the information.
Yeah.
So,
and in fact, we cannot say everything in a 15-minute video. Yeah. All right. Bye. See you next time.